Hello, everyone. Welcome back to another episode of the MSNS podcast. I am your host, Ryan Lim.
And I am your co-host, Alan Tan. And today we have a very lovely guest. Could you introduce yourself for us?
Hi, I'm Joy. And I guess I used to be the career chair for MSNS.
Yeah.
Yeah.
Yes. Joy Pham. Yes, she is an amazing guest. She graduated in recently, 2020, May of 2020?
2020, yeah.
And now you're at the Mayo Clinic on the cardiac care unit as a cardiac ICU nurse.
Yeah. Crazy.
Where's it at?
Change.
Where is it at? Let the viewers know.
It's I'm in Rochester, Minnesota now, and yesterday was actually pretty nice. It was like 40 degrees. Today's snowing. So a little cold.
What's that like? Snow?
Yeah, snow.
Pretty wild.
Okay, so how's that been? I know you're still in your new grad residency, is it called? Just new grad program, correct?
Yeah, pretty much. Kind of. With COVID, it kind of got canceled, but if it was going on, I would be in it.
Oh, how's it like? What do you mean canceled? Does that mean you're just being a full-fledged nurse instead of like kind of slowly going through it?
So what I didn't actually really get when I was looking for jobs is like there's a difference between like orientation and residency. So orientation's like when you're working with your preceptor. But then residency, at least for Mayo, is like when you take all these classes and like it kind of helps you transition from being a student to a nurse. Like it helps you figure out like taxes and like all this like full-time job
That's
stuff.
important.
That's actually super cool.
That's actually good.
Yeah, I never knew that was a thing. I thought like when you were to go into a new grad program, they're like, okay, yeah, so you're gonna have a preceptor for a few weeks and you're on your own. Good luck, you know? But now I'm just like hearing that. I'm like, yo, they tell you how to do taxes? That's insane.
That's kind of
well, at least they were supposed to. They didn't really. Well, I guess they had it optional. They're like, oh, we're gonna still do it. It's gonna be optional now, and I just didn't do it.
Yeah.
So wait, so does that mean it like because of COVID and the cancellation, it transitioned from a residency into like an orientation type of thing where you're just like with a preceptor?
No, so there was always an orientation part of it, and that didn't really change because of COVID. It was just the classes that kind of changed, but the orientation, like working with the preceptor, I think everyone goes through it, and just like the amount of time is just going to depend on like the hospital, the unit, and on you, you know.
Okay.
Yeah.
How was that experience? Like going through that process as like going to that preceptorship?
It was interesting. Like I honestly just felt like a student throughout most of it, and I still kind of feel like a student, you know. Like it's kind of weird that I finished orientation like maybe 3 weeks ago, and now it's like it's just weird that I'm the one kind of making the decisions now. I'm like, who let me, you know?
Wow. Look at you go. Oh my goodness.
Yeah, it's crazy.
How do you feel about that? Like, you know, because I feel like throughout nursing school, for the most part, you kind of always had that safety net, but then now, you know, 2 weeks in, you're kind of on your own. How do you feel about that whole process?
It was like really nerve-wracking at first, but honestly, like I just asked questions, and I think when I was on orientation there, I didn't have as many questions because I still had that safety net. Like I could still like ask my preceptor, or she would catch things for me. Like I remember there was this one day when I had a patient who came back with a pacemaker, and I've never had that before. And she was like, were you going to ask me like what to assess? And I was like, honestly, no. I was just gonna do my head to toe like normal, like there's anything special. And she was like, well, you know, like some things there are like special considerations. If you ever don't know, you can ask someone, or you can like look it up. And like now that I'm on my own, like I can catch those things myself. Like I'm like, I don't have a safety net, and I'm like walking to a room, I'm like, wait, I actually don't really know about this. Let me ask someone, or let me grab someone to help.
Yeah.
And so it's really nice that my coworkers are so helpful, you know? And I think that makes it a lot easier when your coworkers are really willing to help. And they're not either. Yeah.
I feel like that's like a super good thing about going into nursing when you have a good team around you. Like it's always good to just ask them if you have questions or not, because when you're a new grad, you're not going to have the same experience as them.
Yeah.
Even if they're like 2-3 years in, they're still going to have more experience than you. I feel like for a lot of new grads that do continue their nursing career, as soon as they come out of school, it's really important that they know that it's okay for them to ask questions.
Yeah, for sure.
So Joy, what you're saying is like for the most part is what you're kind of learning in your specific specialty, is that something like all the things you're learning, is that kind of learning as you go on the job, or
Kind of, yeah.
right? Because I feel like that's such a huge transition, because in nursing school it goes from like you learning things in a lecture in the classroom setting and then trying to implement them if the opportunity is given in the clinical setting. But now instead of having that space in the classroom to study, you're kind of just going through the motions and learning as you go. Do you think that's in a way better for you? Is that a better way for you to learn, or how has that been?
Well, it's what I do learn, I feel like I retain more than school. Like in school, honestly, I thought I was like retaining everything. I was like, oh, I can still remember stuff at the end of the semester, but once the semester was over, like I don't remember it, So it's like you're not actually remembering that much. But here it's like I'm still taking notes, and I have like a little notebook of stuff to refer to, and you can always look things up, which like in school, I think honestly, you learn so much, but then it's like you also don't learn anything at all. Like a lot of the stuff I'm learning is very like unit specific.
Mm-hmm.
And there are things where I'm like, oh no, I just learned that in school. And like the other nurses like who haven't seen it ever. Like one time we had this patient with like some thyroid issue, and like all the nurses were like, what is that? And I'm like, oh, I just learned about it like 2 years ago. Like I kind of
Yeah.
So it's
Like,
interesting.
Like what's interesting about that is like I always tell Ryan and like everyone else in my cohort, like, oh, I learned so much more in clinical than I ever do in the classroom. 100%. Like a lot of the things I learned how to like think in a nursing sense, I learned that from my preceptors and like my clinical instructors. I don't learn that much in class, rather than all like the numbers and all the the mumbo jumbo that you learn, the nursing vocabulary. So would you say that you're learning a lot because you're always on the floor and you're always like willing to ask questions and learn?
Yeah, definitely. And just like you just see the same type of population a lot. And so once you see it a few times, it's like the next time you're like, oh, this looks familiar. Like I know what to do. I know what we did last time. Like I can do this now, It just, I think, comes from building that experience and seeing like how other nurses handle it. And,
And what is that specific population, or like, and certain diseases that you see a lot on your unit? Can you talk a little bit more about that?
Yeah, sure. So Mayo Clinic is like super specialized. And so our cardiac ICU is split up into two. There's a surgical and a medical, and I work on the medical one. So I don't really work with like CABGs or ECMO or anything like that. I mostly work with like STEMI, arrhythmias, heart failure, pre-transplant. I think that's like our typical population. And then like occasionally we'll get something different, but for the most part, those are the patients we get.
Okay. And since COVID has started, you didn't have to, like, was there any time where the Mayo Clinic made you guys into like a makeshift COVID ICU unit, or has it always been like cardiac focus even through this whole pandemic?
Yeah, it's been cardiac focused, but of course, if there's like a patient who happens to have COVID, but their primary problem is cardiac, like then we'll take them, but otherwise they go to the MICU.
Yeah.
Straight to the NICU. Cool.
And I guess, I don't know, one thing I was curious, like when I was like thinking about like, oh, what should I ask during this podcast, was like, is it everything that you expect? I feel like that's a huge question that a lot of people have, because a lot of people want to go into the ICU, specifically in cardiology or ER, whatever. They have like this idea in their head of what it's going to be like. But what was that how it's been for you, or has it been different from your perception in nursing school?
Well, it's hard to say, because I was a student intern on this unit before, so I kind of knew what to expect. But I guess when I was an intern, it was was pretty different than what I expected. Like I kind of expected like, oh, everyone there's super sick, they're all intubated, they're all sedated, you can't talk to anyone. But that's like not the case. It's like at least on my unit, like only a handful are like that sick. Most of them like you can talk, you can walk around with them. But I will say, like, I think now that I'm a nurse, like I remember in school, like especially like what sophomore one, like all the fundamentals, like, oh, who cares about like turning, like, you know, who cares about this, like if someone's dying, I'm not gonna turn them. But now it's like, no, now you have to schedule in your turns, like it's actually so important, you know, like all these things where I was like, who cares? But yeah,
it's the little things, you know.
Yeah, it's interesting.
So when you're on the unit, what's like your daily schedule? Like as soon as you go into the unit, I know you have like handoff and everything, but what goes on after that?
Kind of depends. If I have 2 patients, I know things can get kind of busy, so I'll like right away like just get my assessments in, start charting, and then when 8 o'clock hits, like I'll do the assessments, start charting, get ready for rounds. Rounds was something I didn't even know about as a student. And it was like a little intimidating at first, but now it's like, it's fine to me. But then when 8 o'clock hits, I'll start giving out meds and stuff, just so I can stay on top of things. But if I only have one patient, like you kind of have time to sit there and like look up things and like think about like how you want to go about your day, you know? But yeah. And then for after rounds, which is like kind of when the resident and the nurse present the patient to the fellow and the consultant, the whole team, and kind of talk about the plan for the patient and any concerns. And then those get addressed. And then based on that, you might have orders or you might have to change your plan or something. So then it's hard to plan the rest of your day, but yeah.
And I'm just curious, how was that initially as a new grad, or even like now, even though you're 6 months in, how has it been, you know, working in that, you know, interprofessional setting? Because I know that as a nurse, we are supposed to be like these huge patient advocates. And if we see something that's wrong, we're supposed to, you know, speak out. But do you think, has that ever been difficult for you since you are just a new grad versus like all these other experienced nurses and doctors? Has that ever been difficult?
It's never been difficult for me to like bring up a concern. It's just difficult for me to know when I should like push back more, because like, you know, I'll be like, this patient's really short of breath, like I think we need to give them more Lasix, and the resident will be like, okay, like I'll come take a look, and I'm like, okay, like they're really short of breath, like
now.
Yeah. And then I'll go out and tell my preceptor, who has like 10 years of experience, she's not afraid to speak her mind, and she'll come back and she was like, our standard is to give Lasix and put them on BiPAP if they're this short of breath. And we're like, okay. And like, you know, I mean, I would never do that as a new grad. I'm like, maybe in 10 years I'll do that and I'll be great, you know. But,
I feel like just having that experience makes a big difference too. Because then sometimes I feel like if I were in that same situation, I would second guess myself before I really like put my foot down and be like, hey, I need this right now. Like I know I want to provide the best standard of care for my patient as possible. But then in the back of my mind, like, am I sure that's like what I want to do right now?
Right.
You know? Is that like the right decision?
No, I know. I do like question myself a lot, but what I've learned is like as a nurse, even like especially a new nurse, it's like the only thing you can do is bring up the concerns, and you just have to trust that the provider knows what they're doing, you know?
Yeah, hopefully. And how's it like? How is that environment? Do you think that culture, whether it's like specifically your unit or just that environment and culture in Minnesota, has that been a huge difference compared to, you know, back in SF?
Yeah, I think so. I mean, I didn't have much of a capstone, but it's just like Mayo, we just like have so many resources. Like we have so much staff to help out. Like they always staff an ancillary nurse who's just like an extra nurse who floats around the unit and helps out. Whereas like on like the few shifts I did capstone, it was like they were pairing up patients that at Mayo Clinic, like that would be a 1 patient assignment because it's so busy, you know, there's just so much to do. So I think it just comes down to the resources they can provide. Yeah.
And How's that transition been? I think, because I feel like, when I first heard that you were going to go to the Mayo Clinic, I was like, oh my God, that's so cool. It's like, oh, by the way, it's in Minnesota. I was like, oh, that's a little far. Are you there?
Yeah.
Are you there with like roommates? Or are you there just like completely alone?
I have a couple roommates who are super great.
Okay, that's good.
Yeah, I know them through one of my preceptors from when I was a student. Like she moved out about the same
wow.
time I was moving in, and she was like, "Hey, like, do you just want my room?" And I was like, "Yeah, I'll take it."
Dang, that's nice.
Yeah, so it worked out really well.
Okay, that's good. Yeah, because I think, I don't know. I've told this in previous podcasts before, and to Alan too, about how, I like the idea of kind of getting out there and moving out of state to see how, but then like I'm always scared because like I think, when you're moving out as a new grad, it's going to be super, super stressful. And I think, everyone needs that support system. But I think,
Right.
So I'm always scared that if I move out and I don't have anybody else to move out with me, then who else is going to be there, to help me through all this? But it sounds like, you having a couple of roommates, I assume are nurses too, kind of help you kind of through all that.
Yeah. No, it's been good. I mean, I personally, I grew up in the Bay Area like my whole life, lived there my whole life, and I did want to get out. Like I was like, I want to see other parts of the world. I was hoping to see somewhere more fun than Rochester, Minnesota. But this is where I landed, and it's been fine.
Yeah.
But I think it would be a lot harder if I didn't know like anyone. Because I did have a couple friends from the internship who moved here, and that made it easier. And it would be a lot harder with COVID, because it's just so hard to go out and meet people. But I mean, I think like my coworkers are nice enough that like I feel like at least supported at work, and I still keep in touch with friends from college. So it's like manageable,
That's good. That's good.
Yeah. How's the work dynamic with coworkers? Because from my jobs that I've taken on previous, like I'm always super close with my coworkers. Like, like it's super easy to get like in tune with them. It's really easy to work as a team. So I was wondering if like your coworkers are as inviting as like my experiences.
Yeah, I would say they are. Like I think coworkers can like make or break a job, And so like, at least the people I've worked with so far, they've all been like super nice and helpful, and like, we can have like fun with each other and joke around, but also like, know how to get the job done, Yeah. So it's been good. It's a really good work environment.
And like in that work environment, how is that pressure? I guess the word is like, how is that pressure? Because I know, you are working in critical care, and a lot of times like it does involve like a large, extensive amount of monitoring like critical patients. How has that been for you? Like just going through all that?
It's been okay. Like my coworkers know, like I'm pretty new off of orientation. They know I'm a new grad, so like they make it a point to check in with me more often.
Oh, nice.
And so I really appreciate that. And like I haven't like off orientation, I don't get like the sick patients on my own. But even when I do feel like when they say, "Oh, you're getting an admin," I'm like, "Oh my gosh, like I gotta prepare for this." Like they're all super supportive. Like, you can do this, like whatever you need, like we'll be out here, like you got this. So it's really nice of them to say that,
And have you been a part of anything like those huge medical emergencies yet? Like have you been able to like get your hands, I hate to say like that, but like get your hands dirty in that, or like is it more like you take a step back and just kind of supervise and see how your preceptors have done it?
The first one I would have liked to get my hands on it, but with COVID, it's just so hard because they're supposed to limit the people in the room, and it's like the last thing they need is like someone who doesn't really know what to do in there. So the first time we had a code on the unit, like I was just kind of watching from outside the room. I was trying to run and grab whatever supplies they needed. The second code, I was like more in the room, still like kind of doing supplies, but maybe like hanging like IV fluids, because I was like, they're probably gonna need fluid. So it was kind of cool to see in the second code, like, oh, I can anticipate some of the needs. Like I know they're gonna need a bag of fluids, they're gonna need this, they're gonna need that. Couldn't anticipate everything, but it's just a start. So that was cool. Yeah.
And do you like, this is always a common thing that I want to know about critical care nurses, like the ones that are seasoned, do you see that it's been a little bit more desensitizing for them, and that No,
Actually,
really?
no. At least
Oh.
for my coworkers. Yeah, no, it's like they know when like something wrong was done. Like they know when something was rough.
Mhm.
And like they'll talk about it and they'll debrief it, and
Okay.
everyone's upset about it,
Mhm.
And I think that comes down to like we're not burnt out. Like the staffing is good enough where it's like you don't feel like super overworked every single day. Like
Mhm.
some days you do, but most days it feels very manageable.
I don't know. I just feel so surprised about that for some reason. I'm just like, oh, because like I don't know. I just like I shouldn't have this expectation, but I kind of do that. Like,
Yeah.
if you've
No,
been in that field for so long, right?
right. No, I totally get it, And like I will agree there's like a couple there are always some who are like, I just want to get out of this. Like I just want to like retire or like go to CRNA school where I can make money and not talk to anyone, which is fine,
Uh-huh.
But yeah, I think for the most part, the people I've met and worked with, they're like, that was rough. Like we shouldn't have done that, or like, we shouldn't be doing this to that person. We're causing them a lot of pain, or, they're suffering a lot. We should do something about it. So it's really nice to see.
Yeah, I never realized how important a debrief was until like I actually got the opportunity in clinical. Like,
Oh, wow.
yeah, I was so surprised because like I had never anything like that before. But then one day it was, I think it started in sophomore 2 with Deborah Conroy McHugh. She's the best, the clinical instructor. Yeah, she's awesome. She just literally out of nowhere, she just like sat us all down. It's like, so Ryan, like, how did that go for you? I know like, this patient, has something going on. Like, can you tell me a little bit about that? And like after I talked about like the patient, she kind of said like, no, but how do you feel? And I was like, oh shit.
Yeah.
Yeah, I was like, oh, and then I talked about it, and I think just having that open, area just to like vent and talk about how you went through this whole, thing, this emotional thing, like really allowed me to not kind of just feel so constrained and I guess lead to burnout in the end. It was just super
Yeah.
nice.
Yeah, definitely.
Yeah. Alan, do you feel like that should be more of a regular thing, not just in clinical, but just like something throughout nursing school?
So interesting enough, I come from a swimming background, so I'm a lifeguard and a swim instructor also. So whenever we do rescues or whenever we do something that is just not that good for the team overall, we do debrief in the little break time that we have. So we would get together and like talk about what happened and like how we felt, or like what we thought we could do better, and like also what we thought we did really, really well, because I think that's also really important, especially when you're in a team environment, because you're there to really prop each other up. You're not there to put each other down. So I feel like having good debriefs is really important, not just like provide the best care possible, but also as like self-reflection and like also learning from those experiences, because not every nurse and not every person has the same experiences. So having the ability to really express your thoughts and how you're feeling about everything is really crucial to like just developing yourself and developing your team. And it's really good to hear that you're able to debrief with the other nurses so easily, and they're all very responsive, because like you said, not every unit's going to be the same, and there's always going to be like some asshole in there that just doesn't contribute, like I've had that experience too, like just in jobs, or like I can see like nurses sometimes just like don't really care, and it's really heartbreaking, because there are people there that care, and there are nurses there that are really into their job and really want to like have the best outcome for everyone, not just their patients.
Yeah. And it sounds like, Joy, for you, that those debriefs not only help the individual nurse, but it also helps the whole team dynamic. Because maybe if there was a code or something going wrong where it did involve a team, being able to communicate what we thought could have gone better, what went wrong, stuff like that. It sounds like it just helps improve communication, so there's no resentment or confusion about who did what, right?
Yeah, I think so. Yeah. And I think it just helps, like, I don't know if bonds is like the right word, but it's like we all just went through something traumatic.
Yeah, I like that. Like having that bond and having that experience together, it's like developing that, and you can get closer to your coworkers, and like you have something in common that you guys are working on and you guys can recall back to. I think that's really important.
Yeah. So I'm curious. So where you are in Minnesota, like Rochester, is that an area that's more isolated, or like is it like one of those major cities? Sorry, I feel like I'm so incompetent with my
Yeah, same. I
geography.
like Rochester,
Yeah,
Minnesota. Dude,
Oh my
I'm a
God.
Bay Area boy
yeah.
too. So
Because
like,
like,
it's just Bay Area for me, man.
because like me
Yeah,
asking that is
no.
like a transition to say like, does that mean like where do the patients come from? Are they just from around your area, or do they get like flown in because it's the Mayo
It's
Clinic?
it's so funny. It's like one of the most common questions like everyone asks each other is where are you from? Like we'll ask all our patients that and then they'll name a city and I'll just pretend like I know where that is. I'm like, oh,
Oh
okay.
yeah.
Like, all
I've heard
right,
about that
cool.
one.
How far is
Yeah.
that? They're like, oh, it's like an hour away. I'm like, okay. I'll be like, oh, it's like 40 miles northeast of here. I'm like, yeah, I know where that is.
No, but it's like the same in the Bay Area too. Because then sometimes, like, because I'm from San Francisco, so like I only know everything from like the west side of the Bay Area. So everything on the east side, when they say like, oh, Livermore,
yeah.
I'm like, oh yeah, I know where that
Yeah.
is. That's your San Jose, right? But it's like all the way to the East Bay. Like, oh, love that, man.
No, so Rochester itself is like the whole town just revolves around Mayo. Like you either work here or like your spouse does, or like you're a long-term patient here or something. And then the Twin Cities, so Minneapolis and St. Paul, which are, I don't know if they're the capital, I really don't know, but they're the biggest city in Minneapolis. They're like an hour and a half away from here. So I guess it would be like from San Francisco to like San Jose-ish.
Okay.
Yeah.
And is Mayo Clinic like, you kind of touched on it, but like, is it like the go-to place to go? Like, because I like, is there like a certain specialty that Mayo Clinic has?
Oh, I mean, it's the #1 hospital in the nation.
Oh shit!
I don't know. It's I don't know. We get, at least my unit, we get a lot of patients from outside hospitals, like that aren't like STEMI hospitals. So they have to come here because we have a cath lab and like those hospitals don't.
Oh yeah.
So, you know,
So it's like one of the bigger hospitals.
Yeah.
Like we're so blessed to have so many huge hospitals in the Bay Area. Like,
yeah,
like
literally.
what, like 10 miles out there's another Kaiser, or 10 minutes out there's another CPMC. And like I feel like in those areas it's a lot, like I just want to dive a little bit deeper into like health, like getting adequate healthcare, you know, like especially in rural areas. Do you have a lot of patients that come from those areas that don't have a lot of access to healthcare? And it seems like because they don't have that access, or like to primary care providers and everything, do they seem more sick in your opinion?
Sometimes they certainly always have like a lot of comorbidities, and like you'll like get patients who are like, I was previously healthy, like no one told me that. And it's like, well, no one told you that because you never went to your doctor. Like,
yeah, that's right.
So it's like kind of that where it's like, I don't know if you just never went because you don't want to, or you just don't have the means to, you know, or both. Yeah. So primary care prevention, definitely very important.
Yeah. Like, how's the population there too? Is it a lot of just, you know, white people, or is it very like diverse? Because I know in the Bay Area, you just have like a bunch of Asians and like everything else mixed together, and you have just all these different types of cultures that you have to deal with and that you experience. You know, is it the same over there? Because I've never been to Minnesota, so I'd expect it's just like just a bunch of white people, honestly.
Yeah, well, it definitely is. There's actually like a pretty big like Middle Eastern population, which I didn't expect, but I think like a lot of like refugees come to Minnesota for some reason, not sure. And then there's like a weirdly like big Vietnamese population, like specifically Vietnamese. Like you'll go, like there's 2 Asian grocery stores and you go in there and everyone's like speaking Vietnamese. I'm like, what? Like, I don't know. It's kind of funny.
How do you feel like you have to change the way you care for those specific type of patients? Because I know we're all about cultural competency and like patient-centered care. Do you like, how does that work for you especially? Do you like?
Well, I've never asked or talked to anyone at my hospital about this, but so we always have like chaplains who come around and they like give communion and blessings and everything. And it's like, that's fine because most people are Christian or Catholic, but then like we do have a big like Muslim population that we care for. And it's like, I don't know if we have like the equivalent of like a chaplain to come see them. Like, I don't know, but I feel like I'd probably ask if I do have a Muslim patient. I've actually never had one myself.
Okay.
Yeah.
Yeah. Because I think for me, even though SF is so diverse, I definitely feel like I've taken care, like in clinicals, of like the same type of people, whether they're like Caucasian or Asian, African American, and I feel like because I've been exposed to that, I kind of know how to kind of shape my care if I have to. But I think, I guess it's really good that, you being in Minnesota and in just a completely different environment, you get to get exposed to even more types of people so that, wherever you go next, you kind of have that experience and know like how to advocate for them or how to shape your care specifically for that, demographic.
Yeah. It's definitely not as diverse as San Francisco. Yeah.
I know you're only 6 months in, but like, do you feel like you already kind of know what you want to do next? Like, do you want to stay like in Minnesota a lot longer, or do you have intentions to come back to the Bay?
Well, I plan on staying here for at least like the next couple years, just until I like really feel more confident with myself and I like kind of can start being like, oh, I know what I'm doing more, and I don't have to rely on so many other people. Before I just move on to a new hospital and have to start like the orientation process over again. That's really my reason why I wouldn't move back sooner. I do know I do not want to go back to school. School.
Yeah.
Do not want to do that again.
So no grad school, no NP, anything like that?
No, not in the near future. Probably not ever, but everyone's like, oh, just be open to it. And I'm like, sure, I'll be open to it. But I kind of know, like, it doesn't seem like it's for me.
Yeah, I like that because I feel like for some people, they think like, oh, I'm going to have this road set and I'm going to just go do it. Like, I'm going to get my NP soon or whatever. And I just want to continue with school. But it's nice to hear from someone that's like, oh yeah, I'm cool. I'm cool with school. Like I'm down to just be an RN. Like just give me a few years here. And you said you want to come back to the Bay, right? Or do you want to just go
eventually?
Else? Yeah.
Eventually, yeah, back to the Bay. I mean, just maybe somewhere else more fun than Rochester, Minnesota. I don't know yet. But yeah,
I thought it was what Alan said was interesting because I think there is some pressure in nursing school or maybe even out of nursing school where it's kind of expected that you have to always continuously like level up, whether it's grad school or whatever. But I think, what's wrong with being a nurse? Like, what's wrong with being a bedside nurse? I feel like that's pretty freaking awesome. If that's what you want to do for like the foreseeable future or for the rest of your life, like, I don't think there should be other people that are, forcing you to just keep going and going. Like, you don't need to get your doctorate if you don't want to.
No, exactly. And it's like, I mean, I don't just want to be like a bedside nurse. Like eventually I want to get like a CCRN. I want to be certified. Like I want to be good at what I'm doing and like maybe be good enough to precept and like teach other people. But I feel I don't need an extra degree for that, Yeah.
And it's cool how in nursing that you can go into so many different specialties. Like if you decide that I'm kind of done with this, I want to like try something new, or like I just want to just have a change of scenery. You have that ability to, and it's just like, because I know for other occupations you don't have that, you don't have that luxury. You can't just be like, oh, I'm done with this job. I'm gonna choose to do something else. But that comes with a lot of learning, and it comes with a lot of time, and most importantly, money. Yeah. School's not cheap, man.
Grad school. Ooh.
Yeah, like for USF too. School's not cheap at all, man.
I know. Are you still doing all your classes just online?
Yeah.
Oh.
We got clinicals, or like most of us,
Yeah. I feel like at least you get clinicals. Like I feel like that's the most important, you know?
Definitely.
So like, because this podcast is not associated with USF at all, I just want to say like
be careful. Just be a little careful.
They gave me $2,000 out of like nearly $20,000 I had to pay for this semester in return for online school. So I don't know, man.
Like, quality is definitely an issue right now.
Yeah, like it's just so unlucky how we just have to experience nursing or nursing school during the pandemic. And it's unfortunate for you too, like your new grad program, during COVID too, and your grad or like what's that called? Your senior clinical rotations, right?
Capstone,
Your capstone was also, you know, during the pandemic. So do you feel like if you were able to have like a regular capstone, you would be a little bit more like how would you say?
Like prepared? Oh,
Yeah, like
100%.
a little bit more prepared. Yeah.
100%. Like I came into work and like I was like listening to lung sounds and I was like, I honestly don't know if that's normal or not. Like
I feel that.
it's like I didn't listen to like any lung sounds for like a year because it's like you go to peds and it's like, yeah, I mean you could, but that's I don't know. We weren't doing assessments for ped in our peds rotation really, so it's like, oh shoot, like, you know, I haven't done a full head to toe in so long, and it's like I think if I got to do that in my capstone, I would have been a lot more prepared. Like even if I didn't have an ICU capstone, just doing like a med surg capstone and like having that like assessment and like that prioritization, time management practice would have been so helpful.
Yeah. And I think that's what like so many nursing students right now are struggling with, is because of that lack of opportunity, especially last semester when like it was like I don't know, it's always that thing where you really have to, even though you have to, you know, have that foundation of knowledge, like you really need to do it in order to like fully experience how it's supposed to go. Like I can, you know, read about IVs for an entire year and become like an expert at IVs, but if I've never like actually poked someone, like it's not going to go well, versus someone who maybe learned about IVs for like a week and then has been doing IVs for like a whole year. They're going to know way more, even though I've been studying more, you know?
Yeah, no, I know. And that's like, I like went home that day. I was like, okay, I need to listen to lung sounds. So I went on YouTube and I was listening to lung sounds, but then it's like the crackles on the YouTube videos are like still different than the crackles you'll hear on your patients. You know, it's like not exactly the same. So like just being able to actually work with people is so helpful.
Yeah. Like I've listened to like bowel sounds and like heartbeats, like never really lung sounds. So I really don't know what like a crackle would sound like, or like even with like even if it's like a little bit of a crackle, I just want to know if like I need to tell my primary care provider like, hey, this guy's like he has a fluid volume overload, right? Like we got to do something about this. Like give this guy some diuretics. Like we can get rid of this. But because if I didn't like know what the sound is, like I can't report that, and I like put my patient in a worse condition than they were before, and it's just really unfortunate, right? So it just really sucks how we weren't able to get that clinical experience we need to like continue to do really to continue to be really good nurses.
And I think it really does contribute to burnout when you don't have that balance of like what you learn versus what you're able to implement out in the real world. And that's why I think like so many people during this pandemic, rather than kind of wanting to enjoy the college experience, there's no, you know, because there's no more college experience. It's more like I know a lot of people that just want to jump right into nursing because like once they get there, they know that what they learn, they will definitely be doing on a daily basis. And that's what I feel like I'm excited for. Even though I still want to enjoy my time now, it's like, man, I just really want to be there in front of the patient, see, you know, why, like have that purpose for learning and like working so hard, because it's, you know, the patient's right in front of you. So I know what I want to work towards.
Like the reason why I came into, you know, nursing is because I want to be bedside, you know, I want to talk to the patients. I want to learn that way. And like, just COVID just took all this opportunity away from me. I'm just like, dude, like I've told Ryan and I've told all my friends this, like, I hate doing school, right? I only do it because it's required, right?
Yeah, that was kind of me, but
yeah, like I really do want to be at bedside and I want to learn that way. And it's just so unfortunate that I can't have that same experience. But like you like during the pandemic, I found other ways to, you know, just use my nursing skills. I think just looking for opportunities to really, you know, practice your skills, like practice injections at a clinic or something. Like always try to do a little bit more than the school offers you, because I feel like sometimes they give you the bare minimum and it's really up to you to really go out and really test your skills, you know, test the waters too. Like if you're in so far into nursing school, what if you find out like you don't like it? you know, like it's not for you. Like that's the worst.
Yeah.
Like you put in so much time, you put in so much effort, and at the end of the day, you're like, maybe it's not for me, you know? And it's just, I feel bad for all the underclassmen too, where they were their first clinical experience taken away.
Right.
And like they can't even go to med surge. This, like, I think having those fundamentals when you're in your geriatric rotations and having your first med surge is so important, because that's when you really actually dip your toes into nursing and like, oh, is this for me? And they don't have that opportunity. And I feel like that will affect them major in the long run.
Yeah. And I feel like to that point, it's like, you know, like now it's like you really know that if you are lucky enough to have clinicals, like you need to make the most of it.
Yeah, exactly.
You know, and like I wish like when I was in clinicals, like I don't know about you guys, but I always had days where it's like the nurse, you're just a shadow really. Like they weren't letting you do stuff, or like they were just doing their own thing and you're like trying to run and keep up with them. And like I wish that was like, well, you know, if you want to do your own thing, like maybe I'll go and like assess all these patients, or I'll get them all out of bed, you know, and like actually do something, like even if it wasn't like nursing, if it was more like, I don't know, CNA stuff, like I wish I would have at least done that instead of like just trying to like run and keep up with them. Because it's like you can watch them spike an IV bag, you'll learn how to do that on your own. You don't need to like watch them, you know. You don't need to watch them put meds in a cup and give it to the patient, you know.
Man. Wait, Joy, for you, like in those couple weeks or however long it was, like in your capstone before it got canceled, was it like a lot of the same of that, or do you feel like you were a lot more hands-on? No?
Yeah, well, it was like I got like 3 days there, and like I think on any job really, it's like the first day or two, like you are just watching because you're trying to get a sense of the routine and like how things are done. So that I was like kind of just trying to stand back. I would like do some assessments or do some things here and there. But then like the third day, I think my nurse was just like the float patient. So it's like we didn't even have like a patient of our own. So I was like, well, okay. And then it was canceled. So.
Wait, so do you feel like, does that mean, like, I feel like that is a common thing that I've heard in like people in like nursing school. Does that mean that like almost everybody who graduates, do you think they experience like a huge learning curve once they get a job?
I think so. I think so. At least I did. I know there was a new grad who started with me who also didn't have much clinical experience, and he also struggled a lot. So yeah, I think it was definitely like like a disadvantage to us.
Yeah.
And it will be a disadvantage to you guys too.
Oh yeah, I can imagine.
I know.
Yeah.
At least hopefully by the time you guys are in capstone, like you'll have a full capstone that's like the one that's really gonna help, you know.
Yeah, I really hope so too. Like like being unable to go to clinicals, or not being able to right now, like we're doing virtual sims. We have a clinical. Yeah, I'm not gonna get into that because I'm gonna stir up a storm. Honestly, like, nah, I'm good. But just having a clinical instructor and not having a clinical site just really disappoints me. You know, like they're so knowledgeable and everything, and I want to learn from them. Like when we're in clinicals and we're in the hospital, I'm just like, dude, like these sims are not the same. Like it's pretty much just reading a textbook. You know, it's
just clicking a lot of buttons.
It's like clicking buttons. Oh my
God. Actually, yeah, you have to just click the buttons in order and you're done. Yeah. But real world nursing, it's not like that. Like,
no, I know. I was like, I can't even find the buttons. Like, I don't know what buttons I want. Like, I want the abdominal assessment, but the abdominal assessment did not include the incision assessment. I'm like, what the heck? Like, what?
Yeah. Gosh. I don't know. I think it's so hard. Actually, no, I don't know if it's that hard. I feel like there are alternative ways that we could, supplement our clinical experience, possibly on campus at USF. USF is closed down. There's a lot of space for a lot of nursing students. And I think, extending out the skills lab and the sim lab to like the McLaren or just other huge spaces on campus, I feel like that would help way more than me doing a virtual simulation.
Right. Yeah. Have you guys done a lot of like the sims in the sim lab? Like before, I think sophomore you get like your first experience from it, right?
How many did you do? How many did you do, Ryan? Because I was there for a good few weeks for sure.
I think I only did it like twice or like 3 times, like total. I've seen that dummy, that dude, like 3 times, I think.
Yeah, more like around 2 or 3 for sure, but nothing more than that.
I hated those sims as a student. Like I was like, this is not real. Like this does not help me learn anything. And then like as part of my orientation, we had like one sim day, and I was like, oh my god, this is gonna be awful. Like I hate this. But it was actually like the best sim experience I've ever had. And I was like, I wish USF did sim this way, because you know how they always start. Like this is like a judgment-free zone. Like what stays here, what happens here stays here. Like we're not judging anyone, we're just here to learn. And then like as soon as you come back from the room, you're feeling terrible about like your performance, and then like they immediately hit you with the like, what did you do wrong, what could you have done better? Like that feels so judgy, you know. And it's like your classmates are like, well, they did this wrong, they could have done this better, you know. It's like they're literally judging you. But the sim I had in orientation, they didn't ask us any of that. They were like, so what did you do in the sim first? Like what was your first instinct? Like what made you go with that, you know? And they were like just like going through your thought process, you know. And they're like, oh, that's good. Or it's like, oh, you know, like usually it's when you see this, you want to do this. And it was like very educational, very formal. It wasn't like, you should have done this, you know? Like
I think USF, like I remember when I was like orientation for nursing school, right? My freshman year, that they put us in the sim lab. They're like, yeah, you guys are going to be here for med surg your sophomore and junior year. It's a do or die situation. Like you either succeed in nursing here
pressure
or not. You know, I feel like because of that, like people have such a hard time like doing simulation and like actually replicating what they would do in the real nursing world. Like, and I think that also you having a good clinical instructor that understands how to teach your teach the students really well, like that makes a major difference too. Because in my personal opinion, like or like my personal experience, my clinical instructor was really open to like the questions we had. She would always like debrief us before we go in, and like the people that went in first, we more often than not, we wouldn't really judge them at all. It's just be like, oh, you did this super well. And then we would tell the next group like, oh, maybe you can try this, rather than like, oh, this group did this wrong. Because I don't think that's like a good way to really educate them, because they're going to be like, oh, I did this wrong. Like, no, it's just a small mistake. You're going to learn from it. And that's why you're here in the first place. And it's just all really depends on how your clinical instructor or whoever your tech was like gives you the simulation.
It's very true.
I don't know. I just like, damn, like, it's so important to have those clinical instructors, because they are essentially all your role models. You know, we are social people, and we mimic, you know, what we see. And if we see a clinical instructor that's so inspiring, so passionate and caring, we want to kind of be like them. We want our care to reflect how they care. But if we have, you know, a horrible clinical experience with a clinical instructor that's, you know, maybe a little bit more desensitized, burnt out, you know, is just there for the paycheck, that, you know, sadly might be inadvertently reflected upon us and how we view nursing.
It might be just me, but if that happened to me, I would tell them straight up like, hey, you're low-key ass, man. Like, dude, I'm not learning. Like, help me out here. Like, I'm trying to
advocate.
I'm trying to like do the best I can in this like nursing in this profession, you know. Like you're hindering my experience. I don't care like if you hate your job or anything, or you hate kids, but you're here to actually teach us. Like I don't stand for that shit, man. But I'm just glad that I've had just overall great experiences in clinical, and I'm really glad that Joy, that you had such a good experience with sim at the Mayo Clinic, because that's just like, oh, sounds so good. Like just that telling you like, oh yeah, like how'd you feel? Like I feel like that's like the best way to actually like get this person to learn, get this person to like express their feelings, or get questions out, you know. Like I'm not gonna go into sim and be like, oh, I know everything,
right?
And it's just that
I feel that, because I think and just like one last thing about that, it's just like I feel like if you keep kind of focusing on what you're doing wrong as a result of, you know, them just pushing that on you, then I think it just instills this sense of fear that you're never going to like, move on from, that like in the back of your head, you're always scared to do something, when really I think your preceptor or clinical instructor is supposed to encourage you, not necessarily to take risks in the hospital, but just to like expand your knowledge and be curious about what could, a possible treatment be, what could be a possible diagnosis, rather than being too scared because everyone's been shutting you out this whole time.
Yeah, definitely.
Oh gosh, no, I feel like we just went on a rant about this all day. But no, but like you can tell we're very passionate. You can tell we're very passionate about this.
Yeah, no.
Yeah. Well, I'm just super glad that you've had such a good experience being in a new grad program.
Yeah.
Like when Ryan told me that, oh, we're gonna have a guest that talks about a new grad program, I thought we're gonna have like the worst story about like how you weren't able to like go in at all, and they just like wouldn't let you help with patients or anything. But I'm really glad to hear that you've had like such a good experience and everything.
Mm-hmm.
Yeah, it's been good.
Yeah. Do you have any advice for any of the aspiring ICU nurses? I know there's a lot out there that might be listening. So do you have any advice for them?
It's hard because I struggled a lot in orientation. There were days where I was like, maybe I'd be struggling less if I just started on med surg or on a step down. But at the end of the day, I was like, I love my job. I'm willing to put in this work. Like I would go home, I would like look at my notes, I'd study more. I was willing to put in the work. So I made it out okay. And I was like, I love it. Like, I don't think I'd be happy on a step down, so it's fine. It's interesting though, because I have like overheard other nurses who started as a new grad on the unit, and they're the ones who are like precepting, like they have 5-10 years of experience. And like I've overheard them saying like maybe new grads shouldn't be starting on ICU, which I was very confused because I was like, you started as a new grad and look at where you are now. Like you're amazing. Like I don't know. I don't get it.
They're just projecting. Don't worry. They're just projecting. It's like they had a bad experience as a new grad in ICU, but see you having a good experience, you're like, oh yeah, like they shouldn't do this. Like I hate her for this. Like I didn't have that same experience, so she can have the same experience,
No. Yeah, maybe, probably. I think you just have to be willing to put in the work and be humble and learn, and be willing, like just know that it's tough for everyone, and it's going to be especially tough if you're a new grad.
Mm-hmm. Yeah, and I guess it sounds like never forget that even when you do become a nurse, you never stop becoming a student, right?
Yeah,
because I feel like that's a big thing. People like after they graduate, like, oh shit, I'm done. Like I don't need to learn anymore. But it's like I don't think that's how it works.
Yeah, no, I know, and it's like it feels better when you're learning like stuff on the unit, because you're like, I will see this. I see this every day already. Like I'm going to see it again. So it feels like you're putting in work for something. And then I would also say, like, when you're looking for a job, like I know everyone's circumstances are different, but if you can like go for the big hospitals that have the money and the resources to like train you well and to like put into your orientation. Like I know for me, like I got 2 extra weeks on orientation because I was like, I could like be on my own now, but I would really prefer having more time. Like it would just make me feel a lot better. And they were like, sure, we can give you that. Like they were very flexible with me. Whereas I know other friends I've talked to, like they were like, no, like your orientation's done, So I think it's worth it, even if you have to move or if it takes you a little longer to find that job, but at least you just feel better at the end of the day,
Yeah, I feel like that's such your last part was such an important message, that you like finding a great new grad program isn't just confined to the Bay Area or even California for that matter. Like there are probably a lot of opportunities out there, in the bordering states or beyond that are amazing and that you can just pursue. You just kind of have to take that risk.
Yeah, I feel like just putting your foot in, just taking that one big step is really like the most crucial part in the nursing career. I feel like if you're too like hesitant on, going for that, like you said, that big hospital, or going for those like that have a lot more experience, like I feel like as someone who's going to graduate a year from now, like that's just good to hear. Like it just entices me to take that, like that one big step.
And also remembering that like for you, like your experience, it's what you make of it. Even if you don't have like the biggest hospital or the biggest, new grad program, it's like if you have a positive outlook and a curious mindset, that it can work out just as well, possibly.
Mm-hmm.
I agree with you, Ryan. You're so inspirational.
Oh, thanks. You too, bud. But yeah, thanks again, Joy. That was great. I feel like it was super informative. We got to, vent a little. It was a great podcast.
No, it's just nice hearing from, a nurse that graduated just, a year ago.
Yeah, very recently, yeah.
Yeah, and like during the pandemic, it's crazy. And it's nice to hear that you're having such a good experience. I feel like whoever listens to the podcast is just like can have like a sigh of relief. Like you'll get there,
You'll get there.
Yeah,
We'll get there.
So like it'll work out, as tough as it will be, it'll work out.
Yeah. Right. So yeah, thank you everyone for watching. Special shout out to the people who stayed to the end. I know there are some of you.
Yeah. I know a few that listens all the way through.
Oh, for real? That's good to hear.
Well, thank you, Joy, for being our very lovely guest today. We enjoyed the conversations, and we wish for you the best in your future nursing career.
Oh, thank you. Thanks for having me. Good luck with the rest of your semester here in your nursing career, nursing student career.
Yeah, thank you. All right, and we'll see you guys next time. Thank you.
Peace. Bye-bye.